name's Jane and I'm one of the dental hygienists here at Confidental, and I'm just going to take you through some tips on how to successfully floss your teeth. There are many types of floss available. There's string, waxed, unwaxed, nylon and Teflon coated flosses. It's an individual choice, whatever you prefer to use. I personally use a nylon one because they slip between the teeth easily. Best thing to do with when you're flossing is to actually make sure you take enough, about 16 to 18 inches of floss, so that you actually use a clean piece of floss between each two teeth. A lot of people get tied up all fingers and thumbs when they're using floss, so the best thing to do is to wrap the majority of it around your middle finger, securing it onto the other hand and not doing it too tightly so you don't cut the circulation off in your fingers. That leaves your index finger and your thumb free to manipulate the floss around the mouth, and you actually only need to use a very small piece when you slip it down between the teeth. The most important thing to remember when you're flossing is when you slide it down between the teeth, a lot of people make the mistake of just going straight up and down or back and forth like that. The actual important bit is when you get down to the gum line, just gently cup it around the tooth in a C shape and you drag the floss up 2 or 3 times. Then you do the adjacent tooth from the bottom to the top. Take the floss out, wrap the dirty piece on, unwrap a clean piece so you're always using a fresh piece of floss between 2 teeth. I normally advise patients just to practice on the front 6 top and bottom teeth so they get used to using their hands and their fingers in their mouth. And as you gain more confidence, you can start working more towards the back teeth where it gets a little bit more tricky. But the key to this is perseverance. Alternatively, if you can't get on with floss, there are other aids that you can use to clean in between the teeth, and they're called interdental brushes. There are many types on the market available, and again, it's a preference. We happen to use these small ones here that are handheld. These are actually for people that can't necessarily get on with floss, or if the gaps are wider, these actually work better than just using floss. There's different sizes, they come in a range of sizes, and again, we can help you, guide you through that process in finding out the right size for you. But the rule of thumb with interdental brushes is when you push them through gently, back and forth like that, you need to have a little bit of resistance, but if they're going through too freely, like that one, then ideally that size is too small. You can use them at the front of the mouth, like so. And for people that have got more advanced problems or bigger gaps, you can use them to the back of the teeth like that, and it's just a gentle back and forth motion. And also, you can use them for cleaning in other spaces like that.